They don't even probably know what endometriosis is.
I didn't know.
So how many months did you deal with this pain?
4-5 months.
First point of contact was your gynaec of 15 years who didn't identify it.
So I had tears in my eyes because I was like, what the hell is going on with my body?
just
God,
not
just
knowing.
tell me. Firstly, you have an infection in one ovary, which nobody told me.
How did you keep yourself strong throughout these 4 months where it took that long to get diagnosed?
Exactly, that pain would come and go, come and go. If you're convinced there's something more, listen to your instinct and go get a second opinion.
Hello everybody, I'm Shamita, Executive Director of MCure Pharmaceuticals, and today we're going to talk about endometriosis. So what is endometriosis? This is a condition that affects 10% women in their reproductive age, and it's essentially your uterus inner lining that starts growing outside your uterus. But it is one of those conditions which, the women deal with excruciating pain. There isn't a cure for it. And the diagnosis at times, on average, takes as long as 6.6 years. So to spread awareness on this condition, to make more of us aware of what it's all about, we have a lovely person and a very, very glamorous, fabulous diva, Shamita, here with us. So Shamita, thank you so much for joining us and for sharing your story with us today.
Thank you. Thank you for your lovely introduction.
No, I think this is something that we spoke about. Both of us are very passionate about it because, when we met, we spoke about how the biggest issue is women don't prioritize their health.
Yeah.
They don't even probably know what endometriosis is because,
I didn't know.
You didn't, right?
I didn't.
So tell me about that. Like, how did you find out about it? What were the symptoms?
I think firstly, when I was diagnosed with endometriosis, it took me a while to pronounce endometriosis.
It's a tongue
So what the hell is this condition? But it did take a while for the doctors to diagnose me with this issue. To be very honest, I had to actually change my gynaec. I used to go to this gynaec for about, I think, 15, 20 years.
Wow.
And despite me highlighting to her that, there's pain, she didn't really think it would be this problem. For someone like me, I can take a lot of physical pain.
Okay.
But I actually woke up in the middle of the night with pain. I couldn't handle it. It was that bad. This obviously took a few months to reach this stage. But
so how many months did you deal with this pain before it was
I
diagnosed?
think about 4-5 months.
Oh, that's a long period.
That's a very long
For this
time.
kind of thing.
Yeah.
And then you just wake up and put a hot water bottle or how did
No,
you deal with it?
I didn't really know what was happening. Painkillers, yes, that's the first thing we kind of resort to. But apart from that, I also realized it was getting a little more difficult for me to lose weight, especially on my stomach. There was unnecessary bloating. My stomach would just swell up on one side. I mean, there were a bunch of symptoms. To be very honest, I thought this was just a part of perimenopause. Okay, because I just about introduced myself to perimenopause,
Right.
and I started reading up about those symptoms.
Absolutely.
The anxiety, weight gain. I mean, so many,
And especially around the tummy area.
Yeah, exactly.
That little pouch comes out of nowhere.
So my trainer couldn't understand what the hell was happening. And like I said, there was pain one night. I woke up. The next day, I remember going to the hospital in the day, and I came back at night because I actually went to my gastroenterologist because I thought maybe it's my colon flaring up.
Right.
Because I also have colitis.
Okay.
And he did a physical examination and he said, okay, I think this is, we need to get an MRI done, a CT scan done right away. If it is what I think it is, we need to admit you today. So I was like, okay. Then from there I did the CT scan, with the dye in. They said, we'll pull you out if there's something wrong. We'll have to probably, put the dye in and put you back into the machine and, figure out what's wrong. Then we realized the problem was in my uterus.
Okay.
Then from there, I did a sonography, transvaginal scan. It was just a series of tests I did in that one day and blood tests. And I couldn't really understand what was going on. And when I spoke to my gynaec and I told her, okay, I'm doing a bunch of these tests. She didn't tell me to do those tests.
Okay.
It's just something that kind of naturally happened because the
Your
hospital.
gastro is the one who asked you to do the
Yeah,
test.
my
versus
gastro.
your first point of contact, which is typically the gynac for
Yeah,
any
yeah.
pain of the sort.
So she said, you know what, your body will just heal itself in time. And I made her speak to, the doctors who were doing the sonography and all of that,
Right.
kind of explained to her. And she said, you can take this medication, for pain, but your body will heal itself. So I said, okay, fine. I mean, at the end of the day, you have to trust your doctors as well.
Absolutely.
So from there, I went to my GP.
Okay.
Okay. After a few days, because I was like, I also checked my levels, my progesterone, my our hormones,
Right.
the estradiol and everything. The monthly tests that we do. My levels were way off, and the pain was still there. So she actually said to me, you know what? I mean, pain in the body is there for a reason. And your levels are way off. Something is wrong, and we need to kind of understand what's going wrong. I don't accept the fact that your body will just, heal itself. And she also explained to me that the ratio between your progesterone and your estrogen, I think, has to be, it's like a 1:10 ratio. Mine was like a 1:1,000.
Right.
So it was
Way off.
it was ridiculously high and way off. So she suggested this other gynac to me.
Okay.
She said, please go to this person. I have complete faith in her. Just get another opinion. It was
Right.
just about that. It was a little difficult to get her appointment, but when I finally got her appointment, the first thing she did was a physical examination. And within 2 minutes, she said to me, okay, firstly, you have an infection in one ovary,
Okay.
which nobody told me. I mean, all of those tests that I did also, nobody told me I had an infection in my ovary.
Right.
She said, let us first deal with that.
Right.
And once we finish with the antibiotic course, let's then get to the rest of your hormones.
Right.
Okay? Once I did that, I after about a week, 10 days, I went back to her. She said, okay, fine. Are you okay doing an MRI for me? Because I need to rule out endometriosis.
Right.
So I didn't even know what that was. She wrote it down. I had to literally go back to that paper to kind of, remember
Right.
what she said. So I said, okay, I went in, I did the MRI, and it was a different kind of MRI. Of course, they put in the dye, but then they also put in this gel, into your rectum. And it's a very invasive
Yeah, of course.
process. And for me, I was already suffering with this for, I think, about 4 or 5 months.
Right.
So I had tears in my eyes because I was like, what the hell is going on with my body?
just
God,
not
just
knowing.
tell me.
Yeah, you needed closure.
Yeah.
Yeah.
Because I was trying everything in my power to just feel better, and it was
Yeah.
just not happening.
Yeah.
Eventually, we realized it is endometriosis.
Right.
And that's when, we decided the next course of action.
I just want to again take a moment to say that you had a gynac of 15 years, a gynac in the hospital, a gastro, a GP, and then your fifth doctor that you went to is the one who told you that it's endometriosis.
Yeah. I mean, I didn't
think
even
this
expect
is-
my gastro to tell me, to be honest.
No, but
But-
my point is that, endometriosis is such a common condition these days.
And nobody knows about.
It is a natural thing to rule out when there's pain of this level.
Yeah,
right? But it took you 4 doctors, and the 5th doctor kind of said, please go do this. It could be endometriosis.
Yeah, I was upset.
Yeah.
It is so important to find the right doctor with, the right kind. It's not like, I'm sure she had the information, but I don't know why it wasn't important enough for her to rule it out.
Right.
Do what was necessary. And I do remember going to her 2 years before that with pain. This I think was happening in my body for a year or two before this actually
Was the
happened.
pain only during periods, or was it consistently throughout the month?
No, the last 4 or 5 months, it was just there. It was
Throughout.
horrible.
It was a
pain.
consistent
It
pain.
was a consistent pain. I sometimes could not work out. I had to really cut back on what I normally did in the gym. And for me, it was so frustrating because I'm really passionate about my workout.
Absolutely.
So
So it was very disruptive to your normal routine.
absolutely, and mentally disturbing, emotionally disturbing. And I read up a little about endometriosis.
What
and
was your first reaction? Because Google is one place that can scare the hell out of you.
everything leads to cancer on Google.
It's just
it's
there's so
ridiculous.
much misinformation.
Yeah, absolutely.
So did you freak out when you Googled it and just saw all
did.
kinds of data?
I did. I did freak out a little, but a lot of things also fell into place
Okay.
when I read that
It
information.
also gave you closure.
Absolutely, because
Oh, this makes sense. This happened to me.
yeah, because you know what, anxiety and depression is also one of the symptoms.
Absolutely.
And that was a big one for me.
Yeah.
Because there were a lot of things I was going through that I could not understand why.
Right.
Because I have been through depression in the past.
Right.
And I continue with my therapy.
Right.
But for me to suddenly go back into that phase, I was almost like knocking on that door,
Absolutely.
but I was pulling myself back from
Right.
getting back into that.
How did you do that?
phase.
I think you just said something about therapy and having gone through it before and not wanting to go down that path again. But I think this is an important message for the audience that when you feel yourself just getting sucked into that level of mental health, how did you bounce back? How did you help yourself?
It took me years to get to where I am today. I handle my emotions differently now. So there was a point where I would just react to everything that was alien to my understanding.
Yeah.
But now I think I kind of analyze things differently. I kind of let things be a lot more
Just
now.
that feeling of a little bit of surrender and letting go.
Absolutely. And my therapy helps me a
Helps a
lot.
lot.
I have a fantastic therapist. And I literally vomit out all the negativity in that
that itself
office,
is healing,
that clinic.
Having a non-judgmental listener.
Absolutely.
It
Yeah.
heals you, right?
Yeah, absolutely.
Yeah.
And even having a therapist to an extent, I think, is so taboo out there.
Absolutely.
Just thought of having one or being in therapy or, being on medication and all of that.
Right.
But
You do what it takes to help yourself.
absolutely. I mean, as long as you want to help yourself, because the first thing the therapist will ask you, at least my therapist asked me, was, do you want to help yourself? Because if you don't want to, there's no point going to that office and,
Absolutely.
wasting time.
Yeah. But Shamita, we're reaching a world now where I honestly believe that even the patients, the women, need to start asking questions.
Oh,
right?
yeah.
And they have to take charge.
Yeah.
So, for example, after listening to your story, I'm sure if another woman feels a lot of pain, which is not just during menstruation, but like yours, it's consistent throughout the month and it's in the lower part of the body.
Yeah.
When she goes for a gamut of tests, she's going to ask, hey, get me checked for endometriosis.
Yeah.
Right?
Yeah.
So I think one of the points is how do we empower more women to ask for it even if the doctor misses it? Don't
Yeah,
you think that would be a
absolutely.
game changer?
100%. But also, a lot of times when you're diagnosed with endometriosis, surgery is not your first option. For me, it wasn't. I was given an option of going on the pill. And that is something I was always against because there are so many side effects.
Correct.
And I spoke to a lot of people. They spoke about, your skin will look great while you're on the pill, but when you stop it, there's horrible hair loss, there's weight gain. There are so many side effects that I was not ready for.
Right.
So that was my first option.
Taking the birth control pill.
Yeah.
Right.
And I even went there. I tried it,
Right.
but I broke out on my skin.
Oh, okay.
The first thing you said to me when I sat here was, you have
Yeah,
clear
you have
skin.
beautiful skin.
So for me, touch wood, for me, having a bunch of pimples on my face is
Right.
something I'm not used to.
right.
That would cause a different kind of
Anxiety.
Yeah,
It's a
for
fact.
me.
For anybody.
And there's so many people who suffer with that, you know.
Yes.
But I said, okay, I can't do this,
Right.
But so I think that is one of the reasons. For me, I think the endometriosis, like you said, like you explained beautifully, it's the lining in the uterus that grows outside.
Yes.
Some of it basically goes out from the fallopian tubes in
Yes.
reverse.
Yes.
And, gets deposited on your organs in that area.
Right.
So that is what had happened with me. It was kind of spread out, and my left ovary was stuck to my rectum.
Oof.
Yeah.
Okay.
So that is why the pain was more
On the
here,
left side,
more on
concentrated
the left side.
When you see the statistics, there is a very high chance of recurrence.
It coming back,
It comes
exactly.
back. It grows back because your body
Yeah.
has a propensity
Yeah.
to get into that.
Yeah.
So how are you self-talking yourself post-surgery?
So, I mean, I did ask my doctor this question. She said, we're going to regularly keep checking you,
Right.
you know, whatever physical examinations they need to do. Having said that, I'm still working on my hormones.
Right.
It's still a little off.
Okay.
It's taking my body some time to heal. Firstly, I didn't think it was that big a surgery, because when they say laparoscopic surgery, in your head, you're like, okay, it's like a 10-minute or
How
like
long
a
was it?
half an hour. It was a 3.5-hour major surgery.
3.5 hours. Because just getting all that tissue out.
I don't know. I mean, when I went there, I was actually ready to go into the OT. I asked the doctor, I said, it's a small surgery, right? She said, no, it's major surgery. So I was like, okay.
You weren't prepared for it.
Yeah, and even when I came, when I got out of the hospital eventually, it took me a while. I think it's been almost 3 months now. I've just been feeling a little better, probably 2 weeks, since 2 weeks.
Okay.
So that pain was still there a little bit, not in
It
that
didn't go away
magnitude.
after surgery.
No, because that was also surgical pain.
Absolutely.
And you know, I think I just about started working out 2 weeks back. So then too, I'm kind of taking it slow.
Right.
I definitely cannot ignore the fact that I am feeling lighter. And maybe that it's a good thing I went in for the surgery. At least that part of it is, you know, taken care of. But yeah, I mean, one thing I would tell all the women out there, our hormones actually control us sometimes.
Yeah, of course.
You know, and we have to learn more about our hormones and what we need to do for them, what we need to do for ourselves. You know, don't just be okay with what the doctor tells you. If you're convinced there's something more, listen to your instinct and go get a second opinion, because sometimes that is needed.
No, I completely agree with you. And, hats off to you, Shamita, because firstly, I've been running the show for 3.5 years. And most women don't even want to talk about their health issues. You're a celebrity. Celebrities have these crazy egos where all the more reason they don't want to talk about it. And I just heard that only last 2 weeks, you've got your life really back in terms of your workout schedule. You're still figuring things out in terms of what to do with your hormones.
I'm still struggling with 3 inches more on my waist that just refuses to go. I'm like, what the hell? Okay, what are you waiting for? You know?
Yeah. So, I mean, it's so soon after your surgery.
Yeah.
And, I saw your Insta post. The way I got to know that you've gone through surgery for endometriosis is you had this proud photo and little video you had made, I believe,
put up a little
on your
video.
Insta. You were in your green hospital gown.
Yeah.
I remember in that video is so clear in my head,
Yeah.
and a picture speaks a million words. You were in that green, hospital gown, and you had the biggest smile, and you said,
cap on my
with a cap, and you're like, I have endometriosis. And I've come out of it and all is well. And I think that video and then what you're doing right now, so soon after the surgery, hats off to you.
Thank you.
And you don't realize, but you have educated so many women and men too. I mean, men have to also start getting involved. And if a woman forgets because she's too busy, I'm sure a guy can remind her, hey, go get checked for endometriosis.
Yeah, that's
The pain
asking
is
for a
not
bit
going
too
away.
much.
I
I don't think
I'm an optimist.
Yeah, the
I'm an
society.
optimist.
Yeah, we live in the men. I think don't really. I'm telling you, it really annoys me. There are so many of these videos, these memes that go around, where men are making fun of how women react, but they don't really understand that sometimes we are controlled by our hormones.
Absolutely.
It's not something we kind of want to do or be. It's just the way it is. That's the way we're made.
Yeah.
So it's kind of sad, but yeah, it would be nice if they would, if
make
men
a little
out
extra
there,
effort and
would be a little
also nudge the women a
sensitive.
bit,
Yeah.
Okay, you've not gone for your annual checkup. If the pain is there, I mean, they should get educated about, like you said, endometriosis. It's a tongue twister.
Yeah.
Right? I mean, learn to say it, learn what it means, learn what the symptoms are.
Yeah.
Because, you've got pain, persistent pain as one of the symptoms. and whatever, in a year and a half to 2 years at least, because you're aware, educated, you take charge. You were lucky to be in a city with good doctors. You were able to diagnose and get something done in a span of a year and a half to 2 years.
Yeah.
Whereas the average age in the US is 6.5 years. So just imagine the number of women who suffer in silence, who don't really go out there and take charge.
Yeah.
We don't need to suffer in silence.
Absolutely.
It's better to learn how to pronounce the word,
Yeah.
learn what the symptoms are. And pain
Yeah.
is not the only symptom. There are a lot of
there's
other
a
symptoms.
bunch of
I'm sure when you
symptoms.
Googled, you must have read about
Yeah. I'm telling you, things just fell into place.
there's excessive bleeding at times, and you don't know why there's excessive bleeding.
Excessive bleeding, there's also bleeding sometimes after sex.
Yes, it's
There's-
painful.
It's
very painful sex.
Yeah, a pain
Yes.
during sex.
Yes.
There's, a bunch of things that we don't really know about. So, I would seriously again tell all the women out there, just read up about
Yeah.
this issue because it is so common and we just don't do enough about it.
I don't want other women to suffer in silence,
suffer.
to go through something that I went through. If my 20-25 minutes on Namita's talk can make that woman who's feeling pain, tube light batti jal gayi ki, oh, it could be endometriosis, let me
Yeah.
go get checked.
Yeah.
Then she may find it out sooner or diagnose it sooner
Yeah.
than you did. That's the
Absolutely.
only goal in your mind.
Absolutely.
And I applaud you for that. I celebrate you for that. And I'm
Thank
so
you.
proud of you for that.
Thank you.
So thank you. This was a very heartwarming, a very beautiful show. We usually have doctors coming and talking in very
wow.
technical terms, which is also needed.
I may have made a few
No, it
mistakes
doesn't
also
matter.
along the way, whatever little
Trust
information
me,
I had.
I'm from pharma. I've been in pharma for donkey years, but I forget things. That's not what matters. What matters is your spirit. Your spirit to come here, talk about your journey in such honest and candid terms so you can help others.
But thank you for talking about something that is so real.
Yeah.
It's refreshing. It's nice.
I think this is probably one of the few, in fact, I would not be surprised, one of the first Indian celebrities who's talking about endometriosis. It's very common in the US.
Oh yeah.
It's a big movement in the US. Lot of
Yeah.
voice and even support groups around it.
Yes.
But in India, we've seen a lot of that, thankfully, for cancer, menstruation, mental health is becoming big.
Yeah.
Endometriosis is still something that people are not aware about.
Yeah.
And so I was personally very excited to have you on the show and to talk about endometriosis. It's a very strong women's health topic. And once again, thank you so much.
Thank you.
Really
Thank you so
appreciate
much.
it.
You're really
Thank
sweet.
you. So this was a lovely, lovely talk. When two women get together, there's always warmth. There's always a very high energy. There's always goosebumps. There's always a spirit to make a difference, to do something that helps other women. That's what sisterhood is all about. And today we didn't speak to a doctor. There was no technical terms. It was just all heart. And Shamita brought all heart and that sisterhood to our podcast. And I'm so grateful for that. Thank you.